welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and here are the latest reports from the world of medicine. Correcting septal deviation might reduce the incidence of asthma. Asthma is one of the most common chronic inflammatory diseases confining to the lower respiratory tract that affects approximately 300 million worldwide. It greatly affects one's quality of life despite several treatment options available, though there is very limited information regarding the association between septal deviation and asthma. In a recent study, the researchers have reported that the incidence of asthma was higher in individuals with septal deviation. The study findings were published in the Journal of the Allergy and Clinical Immunology, and the observational study suggested that septoplasty was associated with a lower incidence of asthma, suggesting that septal deviation is one of the treatable traits in patients with such a condition. Mediterranean diet associated with a lower risk of mortality in older adults. Mediterranean diet is a gold standard that includes a lot of healthy foods like whole grains, fruits, vegetables, seafood, beans and even nuts. A greater adherence to the Mediterranean diet, which has been assessed to 20 years of scientific monitoring, is associated with a lower mortality in adults specifically over 65 years. A recent paper has been published in the journal BCM Medicine. According to the conclusions, the analysis of dietary biomarkers in plasma and urine can contribute to the individualized food assessment for such a group of people. During the 20 years of monitoring, there were around 425 deaths either due to cardiovascular causes or even cancer-related incidences. Once the analysis was done, the score of the Mediterranean diet using such biomarkers was inversely associated with all causes of death. Post-ICU syndrome common in COVID-19 survivors. The COVID-19 pandemic has resulted in a remarkable increase in the number of critical illness survivors. These survivors are more likely to have physical, psychological, cognitive problems known as post-intensive care syndrome. The incidence of such a condition, that is the post-intensive care syndrome in COVID-19 survivors, is however very unknown. However, a recent study shows that it is frequent in COVID-19 survivors. There was no presence or correction with the use of benzodiazepines, steroids or paralytics or even on the length of the ICU stay. The findings of the study were published in the Annals of the American Thoracic Society, and in conclusion, the findings indicated that the incidence of the post-intensive care syndrome was very high, with no clear association with specific ICU factors, and that paying attention to this significant clinical syndrome is critical to ensuring the ongoing healthy outcomes. ACSM consensus statement on physical activity in patients with type 2 diabetes. Usually a consensus statement provides a brief summary of the current evidence and extends and updates the prior recommendations. The updated version of the ACSM consensus statement has been expanded to include physical activity, a broader, more comprehensive definition of human movement than planned exercise, and thereby even reducing the sedentary time. Various types of physical activity enhance the health and glycemic management in people with type 2 diabetes, including flexibility and even the balance exercise. A recent study published in the journal Medicine and Science in Sports and Exercise reports about exercise or physical activity in individuals with type 2 diabetes. It read that various physical activity types can greatly enhance the health and glycemic management of all patients with type 2 diabetes, thereby including balance and even exercise in adults. These guidelines are applicable to most people with diabetes, including the youth, however, a few exceptions and modifications. Right lateral position tied to faster esophageal and clearance in gastroesophageal reflux disorders. Gastroesophageal reflux disease occurs when the stomach acid frequently flows back into the food pipe, and it is often characterized by a burning sensation in the chest, usually after eating, which might even worsen at night. A prospective observational study was carried out which measured the concurrent sleep position in patients referring for ambulatory pH impedance reflux monitoring by using a sleep position measurement device. The study, which was published in the American Journal of Gastroenterology, showed that left lateral decubitus position to be related with a significantly shorter nocturnal esophageal and exposure time and faster esophageal acid clearance. Hence, left lateral is the position to follow. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.